And this is Inside Out. It's a brand new hospital, promoted as the model for emergency care for the rest of the UK. But the Northumbria Hospital at Cramlington is struggling to cope with a number of ambulances arriving on its doorstep. Paramedics are unable to hand over their patients. Instead, they're forced to queue in corridors for hours. Costing £90 million, Cramlington's new state-of-the-art hospital was sold as a better way of delivering emergency care. But is it working?
He's bleeding from the head badly and he's in a queue of people waiting to get in. That was outrageous.
It's serious. Out of 10, I would say it's 10. It's unacceptable in my view.
And this is the problem. Paramedics queuing sometimes for hours to hand over their patients. Although these pictures were taken more than a year ago, ambulance staff are still routinely waiting to drop off sick people because the hospital can't cope.
This is the reception for...
When I visited, it was quiet, but just a few hours earlier, managers had declared a major incident status, turning ambulances and their patients away because the hospital was under severe pressure.
This morning, we were NEAT level 4 for about 2 hours overnight, so people would have to be diverted elsewhere for safety. This morning, we're back down to level 2.
We have evidence that handover delays are putting serious strains on the emergency system across the northeast. When the new hospital at Cramlington opened, 3 casualty units at other hospitals across Northumberland and North Tyneside were downgraded to walk-in centres. The changes heralded a new way of providing specialist emergency treatment. The trade-off for longer journeys was promises of better care. But it seems not everyone's been won over. These are people who've written in to complain.
Mum had a fall at home and it looked very likely she'd broken her arm. When we arrived at the hospital, we were left in a corner for 2.5 hours with no triage from staff and no painkillers offered.
State-of-the-art hospital? I don't think so. The ambulance staff told me they have long delays in doing the handover.
As an ex-A&E nurse, I am sorry to see how standards have fallen. If this is a flagship department, pity help us.
So what's going on? I want to find out more. Now, this is our first case. It's Mark. He collapsed in the street and was rushed to the new hospital.
The handover procedure seemed to be almost gridlocked, if I can put it that way. There was a long queue of patients coming in with ambulance crews behind me, and the queue was building up throughout the time I was there.
And this is our next case. This is John. Now, he told us all about the treatment of his dad.
It turns out he'd actually had a heart attack when he was out walking, fell over, hit his head, head wound, he's bleeding everywhere. There was a good 6 or 7 at least gurneys with 2 paramedics per patient in this corridor waiting to be checked in. This isn't even triage at this point, this is waiting to be booked into the hospital.
I've been having a dig around, and here's what's supposed to happen. From the moment the ambulance arrives, the paramedics have 15 minutes to book their patient in, and they should be back on the road within 30 minutes to answer the next call. But I've been speaking to some of the men and women in the front line, and they tell a very different story. They were reluctant to go on camera, so actors speak their words.
The worst for me was when the patients were actually out of the corridor through the doors. Imagine 15 crews out of the ambulance service between Berwick and the River Tyne all the way across to Hexham. So you've got 3/4 of your front line A&E ambulances actually queuing at a hospital.
When you're queuing and you're behind other people, you're looking to see whether that patient is as unwell as the patient you've got. And there's nowhere for relatives to sit. There's no seating area for them, so they have to stand. It's very distressing for the patients and all.
One night, there were 9 ambulance crews waiting to hand over patients with a wait of over 2 hours just to be booked in.
An internal NHS report reveals that for just one day last month, around a quarter of the ambulance crews at Cramlington were stood with their patients for more than half an hour to check in. but it gets worse. Other documents that I've seen show that for a 9-month period, almost 2,900 hours were spent waiting. That's the equivalent of an on-duty paramedic stuck in a queue for an entire year. Look at a neighbouring hospital, the RVI in Newcastle, where it's just 6 days.
It's not good for staff morale, and it's not good for the ambulance service. Those paramedics, it's a waste of their time standing in corridors. All is not well, and things need to be looked at urgently before somebody dies.
These aren't comments you'd expect at a hospital rated as outstanding, and with this recent glowing praise from the man at the top.
What you see here is a combination of highly committed staff, but also leadership which knows how to get the most out of the people. And I think there are a lot of lessons for the rest of the NHS.
But there's less gushing praise from the ambulance service. They're struggling with poor response times, and queues at Cramlington are making their job much more difficult. On a scale of, let's say, 1 to 10, how serious a problem is this for you?
For us, it's serious. I think out of 10, I would say it's 10. In a sense, it's unacceptable in my view. I know there's pressures on the NHS, I know there's pressures on us. In this day and age, we need to be able to find solutions to ensure that we're not holding ambulances up, because we need those ambulances out on the road going to our patients, and when they're queuing at hospitals, we're not able to achieve that.
What actual impact does this have on your service if you've got ambulance crews tied up in a hospital?
We have the inability to respond in a timely fashion, so our response time standards quite clearly are suffering as a consequence.
All of this prompts some questions. Why is a state-of-the-art hospital failing to meet government targets? Centralising emergency care like this is one option for the rest of the country. But is it a model that's really working? The commissioning groups who oversee Cramlington have launched an investigation to try and find a solution to the ambulance bottlenecks. And from tomorrow, the ambulance service has told its staff to stick to the 15-minute handover target, after which time patients become the hospital's responsibility.
The Department of Health got us to spec this for 260 attends a day. Right. We're now regularly seeing 320.
David Evans is Chief Executive of the Northumbria Health Trust. Whilst on a tour of his hospital, he admitted they seriously underestimated the number of patients who'd be coming here.
Even in the 5 or 6 years that it's taken to get this place planned and built, the volumes have gone up significantly. I mean, last 2 years, emergency care in the NHS has gone up by about 20%. It's just, we're not ahead of the game really at the moment.
So how worried is Mr Evans about the problem of ambulance handover delays?
We are very concerned about it. It's been our main priority over the last year. We've got a lot of work going on. It's not right at the moment. We want to fix it. I would offer the apologies, my personal apologies and the apologies of the Trust, to anyone who feels they've been disadvantaged or their care has been affected by having to wait for an ambulance handover.
So are ambulance crews waiting in your corridors acceptable?
It's not ideal, no, but at times of surge, and we do get times when people come in, a lot of people coming together. We've had crazy times where in a 90-minute period we've had 45 unwell people arrive. No system can manage that. We've got to prioritise, we've got to move people through safely, but inevitably at times like that we do have people who have to wait longer than we would ideally like.
Behind the statistics there are real people, and here's an example. When we arrived at the hospital we were left in a corner for 2.5 hours, no triage by staff and no painkillers offered.
That's unacceptable. I apologise if somebody has been left without assessment or painkillers. This must have been at a really busy time. We do have a system which puts senior clinical staff onto those queues to make sure that people are being assessed and brought forward if necessary. These are managed queues. They're not just people waiting in a corridor. These are people who are being assessed, and if their clinical need dictates it, we will move them through the system.
If you look at this pinch point, which you say yourself is a really important one, does it mean this hospital is not really fit for purpose, the way it's run right now?
Not at all. This is one measure, it's not the overall measure. If you look at quality of care, if you look at outcomes, if you look at patient experience, this is doing what it was designed to do. Avoiding unnecessary admissions, getting consultant care at an early stage of a pathway, it is delivering all of that. We have an issue at the moment with the way in which people are accepted into that system, and we've got a lot of pieces of work going on to improve that.
This hospital is pioneering new ways of delivering emergency care, and all NHS eyes are on it. But until it sorts out the ambulance handover delays, it will continue to be criticised by those who matter most, the patients. Now, the hospital says there are early signs of improvement, but with winter just around the corner, any solution could be a way off yet. If you've any experiences of using the new hospital you'd like to share, then why not email me, chrisjackson@bbc.co.uk, or find me on Twitter by #InsideOutCJ.